In this video, we demonstrate a vitrectomy for the treatment of an inferior retinal detachment, previously submitted to an unsuccessful circumferential scleral buckle. The video, shared by Dr. Juliana Prazeres from Salvador, Brazil, features a 21-year-old patient undergoing a new surgery following the failure to reattach the retina using scleral buckle and cryopexy. A 25-gauge 4-port system with auxiliary illumination was employed to perform the pars plana vitrectomy in a young patient with a clear lens. Note that he presented with a macula-off retinal detachment, showing signs of chronicity in the inferior periphery. A major challenge in this type of surgery is inducing PVD. After using triamcinolone, the surgeon increases the vacuum, aspirating from the nasal side of the optic disc, moving towards the periphery and upward to carefully bring the posterior hyaloid forward. Since the patient is phakic, observe how she changes the angle and carefully pulls the vitreous towards a more peripheral and superior area as she moves anteriorly. The folded margins and the flap of the inferior tear are removed using the vitrectomy probe. Perfluorocarbon liquid is then used to flatten the retina and facilitate the removal of subretinal fluid. During the indentation and shaving of the vitreous base, an interesting phenomenon can be observed in this surgery. A bubble of BSS passes through the perfluoro and gets trapped beneath the heavy liquid. This situation can sometimes be mistaken for migration of perfluorocarbon or subretinal fluid. After a fluid air exchange and complete aspiration of the perfluorocarbon, it is evident that the bubble disappears. Given the scenario of inferior detachment with signs of chronicity, the surgeon opts for silicone oil as a vitreous substitute.